What is the connection between attention deficit hyperactivity disorder and anger? The most common behavior associated with attention deficit hyperactivity disorder is anger. Attention deficit hyperactivity disorder affects both children and adults, and many people with this disorder have problems with hostility, aggression, and negative behaviors. Attention deficit hyperactivity disorder behaviors are caused by chemical imbalances in the brain. In some cases, they are a byproduct of secondary symptoms, including loss of motivation, worry, frustration, boredom, anxiety, low self-esteem, lack of sleep, and feelings of hopelessness. People typically exhibit both chemical imbalance symptoms and secondary symptoms when suffering from attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder frustration is the most common aspect leading to anger issues. It is important to learn how attention deficit hyperactivity disorder and anger management can coexist. The first step would be to try to learn how to control the frustration levels. This can be done by establishing firmly rigid routines including set bedtimes, and limited time watching television and using gaming devices. Too many changes at once can lead to new problems, though, so try to avoid making several at one time. Another method is trying to avoid overstimulation. Limit the number of people around at one time. This will help with the attention deficit hyperactivity disorder sufferer's feeling of being overwhelmed while also limiting noise. Most importantly, try not to be too pushy in getting things done. Offer breaks often. The second step would be to teach reduction techniques. This includes counting backward, deep breathing, positive statements, and using pleasant imagery. When these can be accomplished, move on to verbal expression of feelings rather than displays of anger. This tip also is good for people who live with those who suffer from attention deficit hyperactivity disorder and anger, because these people can be just as frustrated in dealing with the issue. There are several other skills for anger management in conjunction with attention deficit hyperactivity disorder. Assertiveness skill helps the person to act less aggressive and more appropriately when asking for something he wants. Skills such as relaxation, problem solving, and conflict management also are helpful when dealing with attention deficit hyperactivity disorder and anger. Another component of anger management is moral training, which helps to teach a person that physical aggression should only be used for self-defense. While these different techniques are used for treating those with attention deficit hyperactivity disorder, a physician will also usually prescribe medications to help. There are many types of medicines available, including psychostimulants and non-stimulants. If the medicine is taken correctly and the coping skills are used properly, those suffering from attention deficit hyperactivity disorder and anger can learn to handle both problems, though abuse of the medication can lead to addiction problems.